Well, infertility is defined as trying to get pregnant with frequent intercourse for at least a year with no success. Female infertility, male infertility are a combination of the two affects millions of couples across the world. An estimated 10 to 18% of the couples have trouble getting pregnant or having a successful delivery. Infertility results from female factors about one third of the time and the male factors about one third of the time. The cause is either unknown or a combination of male and female factors in the remaining cases. Earlier, I uploaded a short video about female infertility on this channel. I hope you have already seen that video, and today I'm going to discuss this in detail. Well, female infertility causes can be difficult to diagnose. There are many available treatments which will depend on the cause of infertility. Many infertile couples will go on to conceive a child without treatment. After trying to get pregnant for 2 years, about 95% of couples successfully conceive. Now I'll tell you about the symptoms. Well, the main symptom of infertility is the inability to get pregnant. A menstrual cycle that is too long, that is 35 days or more, or if it is too short, that is less than 21 days or shorter, irregular or absent, can mean that you are not ovulating. There may be no other outward signs or symptoms. Now I'll tell you when you should see a doctor. When to seek help sometimes depends on your age. Up to age 35, most doctors recommend trying to get pregnant for at least a year before testing or treatment. If you are between 35 and 40, discuss your concerns with your doctor after 6 months of trying. If you are older than 40, your doctor may want to begin testing or treatment right away. Your doctor may also want to begin testing or treatment right away if your partner has known fertility problems or if you have a history of irregular or painful periods, pelvic inflammatory disease, repeated miscarriages, prior cancer treatment, or endometriosis. Now I will tell you the causes. Each of the factors which I am going to tell you is essential to become pregnant. The first thing is that you need to ovulate. To get pregnant, your ovaries must produce and release an egg, which is a process known as ovulation. Your doctor can help evaluate your menstrual cycle and confirm ovulation. Your partner needs sperm. For most couples, this is not a problem unless your partner has a history of illness or surgery. Your doctor can run some simple tests to evaluate the health of your partner's sperm. Also, you need to have regular intercourse. You need to have regular sexual intercourse during your fertile time. Your doctor can help you better understand when you are most fertile. Also, you need to have open fallopian tubes and a normal uterus. The egg and sperm meet in the fallopian tubes and the embryo needs a healthy uterus in which to grow. For pregnancy to occur, every step of the human reproductive process has to happen correctly. The steps in the process are: one of the two ovaries releases a mature egg. The egg is picked up by the fallopian tube. Sperms swim up the cervix through uterus and into the fallopian tubes to reach the egg for fertilization. The fertilized egg travels down the fallopian tube to the uterus. The fertilized egg implants and grows in the uterus. In women, a number of factors can disrupt this process at any step. Female infertility is caused by one or more of the factors which I am going to tell you now. The first is ovulation disorders. Ovulation disorders, meaning you ovulate infrequently or not at all, account for infertility in about 1 in 4 infertile couples. Problems with the regulation of reproductive hormones by the hypothalamus or the pituitary gland or problems in the ovary can cause ovulation disorder. In this, first I'll tell you about polycystic ovarian syndrome, that is PCOS. This causes a hormone imbalance which affects ovulation. PCOS is associated with insulin resistance and obesity, abnormal hair growth on the face or body, and acne. It is most common cause of female infertility. Well, on my channel, I have already uploaded a video about polycystic ovarian syndrome. The link will appear in I button. If you haven't seen already, you can watch that video. That is very informative. Okay. Then next is hypothalamic dysfunction. Two hormones produced by pituitary gland are responsible for stimulating ovulation each month. These are follicle stimulating hormone, that is FSH, and luteinizing hormone, that is LH. Excess physical or emotional stress, a very high or very low body weight, or a recent substantial weight gain or loss can disrupt production of these hormones and affect ovulation. Irregular or absent periods are the most common signs. The next thing is premature ovarian failure, also called primary ovarian insufficiency. This disorder is usually caused by an autoimmune response or by premature loss of eggs from your ovary, possibly from genetics or chemotherapy. The ovary no longer produces eggs and it lowers estrogen production in women under the age of 40. Too much prolactin. The pituitary gland may cause excess production of prolactin, that is hyperprolactinemia, which reduces estrogen production and may cause infertility, usually related to pituitary gland problems. This can also be caused by medications you are taking for another disease. And the other thing important I should tell you is that there are structural damages that can also lead to infertility. For example, damage to fallopian tubes. Damaged or blocked fallopian tubes keep sperm from getting to the eggs or block the passage of fertilized egg into the uterus. Causes of fallopian tube damage or blockage can include pelvic inflammatory disease, which is an infection of the uterus and fallopian tubes due to chlamydia, gonorrhea, or other sexually transmitted infections. Also, if there is a previous surgery in the abdomen or pelvis, including surgery for ectopic pregnancy in which a fertilized egg implants and develops in a fallopian tube instead of the uterus, then there may be cases of pelvic tuberculosis, which is a major cause of tubal infertility worldwide, although uncommon in the United States and some other developed countries. Okay. Then another cause is endometriosis. Endometriosis occurs when tissue that normally grows in the uterus implants and grows in other locations. This extra tissue growth and the surgical removal of it can cause scarring, which may block fallopian tubes and keep an egg and sperm from uniting. Endometriosis can also affect the lining of the uterus, disrupting implantation of the fertilized eggs. The condition also seems to affect fertility in less direct ways, such as damage to the sperm or egg. Then there could be such uterine or cervical causes. Several uterine or cervical causes can impact infertility by interfering with implantation or increasing the likelihood of a miscarriage. Benign polyps or tumors, fibroids or myomas are common in the uterus. Some can block fallopian tubes or interfere with implantation, affecting fertility. However, many women who have fibroids or polyps do become pregnant. Well, I have a video about fibroid on this channel, and that is very informative. You can watch that video. Okay. Then, as I told you before, endometriosis, scarring or inflammation within the uterus can disrupt implantation. Uterine abnormalities present from birth, such as an abnormal shaped uterus, can cause problems becoming or remaining pregnant. Cervical stenosis, which is narrowing of the cervix, can be caused by an inherited malformation or damage to the cervix. Sometimes the cervix cannot produce the best type of mucus to allow the sperm to travel through the cervix into the uterus. This can be also a cause of infertility. Then in some cases there are unexplained reasons for infertility. Sometimes the cause of infertility is never found. A combination of several minor factors in both partners could cause an unexplained fertility problem. Although it is frustrating to get no specific answer, this problem may correct itself with time, but you should not delay treatment for infertility. Now I'll tell you some risk factors. Certain factors may put you at a higher risk of infertility. These include age. The quality and quantity of women's eggs begin to decline with increasing age. In the mid-30s, the rate of follicle loss speeds up, resulting in fewer and poor quality eggs. This makes conception more difficult and increases the risk of miscarriage. Smoking. Besides damaging your cervix and fallopian tube, smoking increases your risk of miscarriage and ectopic pregnancy. It is also thought to age your ovaries and depletes your egg prematurely. Stop smoking before beginning fertility treatment. Weight. Being overweight or significantly underweight may affect normal ovulation. Getting to a healthy body mass index may increase the frequency of ovulation and likelihood of pregnancy. Sexual history. Sexually transmitted infections such as chlamydia and gonorrhea can damage the fallopian tube. Having unprotected intercourse with multiple partners increases your risk of a sexually transmitted infection that may cause infertility problems later. Alcohol. Stick to moderate alcohol consumption of no more than one alcohol drink per day. Okay. Now I'll tell you the preventive measures for women thinking about getting pregnant soon or in the future, and the tips which I am going to tell you may help optimize fertility. These are: you should maintain a normal weight. Overweight and underweight women are at increased risk of ovulation disorder. If you need to lose weight, exercise moderately. Strenuous and intensive exercise of more than 5 hours in a week has been associated with decreased ovulation. Quit smoking. Tobacco has multiple negative effects on infertility, not to mention your general health and the health of a fetus. If you smoke and are considering pregnancy, you should quit now. Avoid alcohol. Heavy alcohol use may lead to decreased fertility, and any alcohol use can affect the health of a developing fetus. If you are planning to become pregnant, avoid alcohol and do not drink alcohol while you are pregnant. Reduce stress. Some studies have shown that couples experiencing psychological stress had poor results with infertility treatment. If you can find a way to reduce stress in your life before trying to become pregnant, okay? Also, you should limit caffeine. Research suggests that limiting caffeine intake to less than 200 milligrams a day should not affect your ability to get pregnant. That is about 1 to 2 cups of 6 to 8 ounces of coffee per day. Okay. And now I will tell you about the diagnosis of infertility. If you have been unable to conceive with a reasonable period of time, seek help from your doctor for evaluation and treatment of infertility. Fertility tests may include ovulation testing, and at home over-the-counter ovulation prediction kit detects the surge in luteinizing hormone that occurs before ovulation. A blood test for progesterone, which is a hormone produced after ovulation, can also document that you are ovulating. Other hormone levels such as prolactin may also be checked. Hysterosalpingography. During hysterosalpingography, X-ray contrast is injected into your uterus and an X-ray is taken to detect abnormalities in the uterine cavity. This test also determines whether the fluid passes out of the uterus and spills out of your fallopian tube. If abnormalities are found, you will likely need further evaluation. In a few women, this test itself can improve fertility, possibly by flushing out and opening the fallopian tubes. Ovarian reserve testing. This testing helps determine the quality and quantity of eggs available for ovulation. Women at risk of a developed eggs and women at risk of a depleted egg supply, including women older than 35, may have this series of blood and imaging tests. Other hormone testing. Other hormone tests check levels of ovulatory hormones as well as thyroid and pituitary hormones that control reproductive processes. Imaging test. A pelvic ultrasound looks for uterine or fallopian tube disease. Sometimes a sonohysterogram, also called a saline infusion sonogram, is used to see details inside the uterus that cannot be seen on a regular ultrasound. Some other imaging tests, depending upon the symptom, may ask, for example, for hysteroscopy and laparoscopy. And also some cases need genetic testing. Now I'll tell you the treatment. Infertility treatment depends upon the cause, your age, how long you have been infertile, and personal preferences. As I told you, you should watch all those videos and which lead to infertility, as I have posted those videos on my channel, and you can also find out the treatment in those videos. Okay. Because infertility is a complex disorder, treatment involves significant financial, physical, psychological, and time commitments. Although some women need just 1 or 2 therapies to restore fertility, it is possible that several different types of treatment may be needed. Treatments can either attempt to restore fertility through medication or surgery, or help you get pregnant with sophisticated techniques. And I'll tell you about fertility restoration, that is stimulating ovulation with fertility drugs. Fertility drugs regulate or stimulate ovulation. Fertility drugs are the main treatment for women who are infertile due to ovulation disorders. Fertility drugs generally work like the natural hormones, follicle stimulating hormone and luteinizing hormone, to trigger ovulation. They are also used in women who ovulate to try to stimulate a better egg or an extra egg or eggs. Fertility drugs may include clomiphene citrate. This clomiphene citrate is taken by mouth and stimulates ovulation by causing the pituitary gland to release more FSH and LH, which stimulates the growth of an ovarian follicle containing an egg. Gonadotropins. Instead of stimulating the pituitary gland to release more hormones, these injected treatments stimulate the ovary directly to produce multiple eggs. Gonadotropin medications include human menopausal gonadotropin or HMG that comes with the name of Menopur, and FSH that is comes with the name of Gonal F, and Folistum AQ or Breville. Another gonadotropin that is human chorionic gonadotropin that comes with the name of Ovidrel or Pagnat is used to mature the eggs and trigger their release at the time of ovulation. Concerns exist that there is a higher risk of conceiving multiples and having a premature delivery with gonadotropin use. Metformin. Metformin is used when insulin resistance is a known or suspected cause of infertility, usually in women with diagnosis of PCOS, that is polycystic ovarian syndrome. Metformin helps improve insulin resistance, which can improve the likelihood of ovulation. And another drug which comes with the name of letrozole, with the trade name of Femara, belongs to a class of drugs known as aromatase inhibitors and works in a similar fashion to clomiphene. Letrozole may induce ovulation, however, the effect this medication has on early pregnancy is not yet known, so it is not used for ovulation induction as frequently as other. Bromocriptine. Bromocriptine, which comes with the name of Cycloset, which is a dopamine agonist, may be used when ovulation problems are caused by excessive production of prolactin, hyperprolactinemia by the pituitary gland. Then I should tell you there are certain risks of fertility drugs. Using fertility drugs carry some risks such as pregnancy with multiples. Oral medications carry a fairly low risk of multiple, less than 10%, and mostly a risk of twins. Your chances increase up to 30% with injectable medication. Injectable fertility medication also carry the major risk of triplets or more higher order multiple pregnancy. Generally, the more fetuses you are carrying, the greater the risk of premature labor, low birth weight, and later developmental problems. Sometimes adjusting medication can lower the risk of multiple if too many follicles develop. Okay, then in that case we adjust the medication. Ovarian hyperstimulating syndrome, that is OHSS. Injectable fertility drugs to induce ovulation can cause OHSS, which cause swollen and painful ovaries. Signs and symptoms usually go away without treatment and include mild abdominal pain, bloating, nausea, vomiting, and diarrhea. If you become pregnant, however, your symptoms might last several weeks. Rarely it is possible to develop a more severe form of OHSS that can also cause rapid weight gain, enlarged painful ovaries, fluid in the abdomen, and a shortness of breath. Then there are some long-term risk of ovarian tumor. Most studies of women using fertility drugs suggest that there are few, if any, long-term risk. However, a few studies suggest that women taking fertility drugs for 12 or more months without a successful pregnancy may be at increased risk of borderline ovarian tumors later in life. Women who never have pregnancy have an increased risk of ovarian tumor, so it may be related to the underlying problem rather than the treatment. Since success rates are typically higher in the first few treatment cycles, reevaluating medication use every few months and concentrating on the treatment that have the most success appear to be appropriate. Then we should know about some fertility restoration surgery. Several surgical procedures can correct problems or otherwise improve for female fertility. However, surgical treatments for fertility are rare these days due to the success of other treatments. These include laparoscopic or stereoscopic surgery. These surgeries can remove or correct abnormality to help improve your chances of getting pregnant. Surgery might involve correcting an abnormal uterine shape, removing endometrial polyps, and some types of fibroids that misshape the future cavity, or removing pelvic or uterine adhesions. Tubal surgery. If your fallopian tubes are blocked or filled with fluid, that is stereosalpinx, your doctor may recommend laparoscopy surgery to remove adhesions, dilate a tube to create a new tubal opening. The surgery is rare as pregnancy rates are usually better with IVF. For hydrosalpinx, removal of your tubes, that is salpingectomy, or blocking the tubes close to the uterus, can improve your chances of pregnancy with IVF. Then lastly, we can also think of reproductive assistance. The most commonly used method of reproductive assistance include intrauterine insemination, that is IUI. During IUI, millions of healthy sperms are placed inside the uterus close to the time of ovulation. And then we discuss about assisted reproductive technology. This innovative retrieving this involves retrieving mature eggs from a woman, fertilizing them and with the man's sperm in a dish in a lab, then transferring the embryos into the uterus after fertilization. IVF that is in vitro fertilization is the most effective assisted reproductive technology. In an IVF cycle takes several weeks and requires frequent blood test and daily hormone injections. Well, this was my video about female infertility. I hope you like this video. If you have any question or concern about this topic, you can post the question in comment section, and I'll try to reply to you as soon as possible. Thanks for watching this video. See you in next video. Bye for now.